Good day, amazing people. Welcome back to this exciting session. In this video, we will discuss cardiovascular geriatric clinical care. Previously, we discussed the core concepts in geriatric care. We mentioned how functional decline can appear before obvious vital sign or laboratory changes, how stressors can cause disproportionate decline, and why recovery in older adults is often slower and sometimes incomplete. By the end of this session, the learner will be able to 1. Describe normal age-related changes in the cardiovascular system. 2. Explain reduced cardiovascular reserve, how aging limits stress response and compensation. 3. Recognize atypical cardiovascular presentations in older adults and identify early indicators of decompensation. Let's see the changes that occur in the cardiovascular system with aging. As people age, the heart and blood vessels undergo gradual changes. The heart muscle becomes stiffer. Blood vessels lose elasticity. Maximum heart rate decreases. Ability to increase cardiac output under stress is reduced. This means that the heart still works, but it cannot speed up and stretch as easily as before. These changes reduce the body's ability to respond to illness, dehydration, blood loss, or exertion. Next, we will look at what reduced cardiovascular reserve in older adults means. Cardiovascular reserve refers to how much the heart and vessels can increase performance during stress. In older adults, resting function may appear normal. Stress response is limited. Compensation is delayed or absent. This explains why older adults may deteriorate rapidly without early warning signs. Another thing to look at is how cardiovascular illnesses present atypically. Older adults often present without classic symptoms like chest pain, palpitations, and marked tachycardia. Instead, cardiovascular illness may present as fatigue, reduced mobility, falls, confusion, shortness of breath on minimal exertion. The early signs of cardiovascular decompensation may include reduced activity tolerance, new confusion, peripheral edema, weight changes, decline in mobility. These signs often precede dramatic vital sign changes. In conclusion, remember, with aging, the heart and blood vessels become stiffer and less elastic, reducing the heart's ability to increase output during stress, even though resting function may appear normal. As a result, cardiovascular illness in older adults often presents with atypical signs such as fatigue, confusion, falls, reduced mobility, or shortness of breath rather than classic symptoms like chest pain. That's it for this session. See you in the next session. Bye for now.